The United Nations says about 5.9 million Nigerians are in need of assistance. At the launch of the 2026 Humanitarian Needs and Response Plan, agencies warn that insecurity, climate shocks and shrinking funding are worsening the humanitarian situation across the country. Muyo Thomas reports.
This launched 2026 Humanitarian Needs and Response Plan targets 2.5 million people out of nearly 6 million Nigerians in need, with a funding requirement of $516 million at a time when global humanitarian funding is declining. The United Nations says humanitarian needs are increasing, particularly in conflict-affected areas of the Northeast, forcing aid agencies to make difficult operational decisions as resources continue to shrink.
Through the Federal Ministry of Humanitarian Affairs and Poverty Reduction, the government will continue to provide policy direction, coordination leadership, and system alignment, ensuring that humanitarian efforts complement broader national reforms aim at reducing poverty, strengthening human capital, and building resilient communities. Distinguished ladies and gentlemen, one of the critical policy shifts under the Renewed Hope agenda is the emphasis on prevention and preparedness. Nigeria can no longer afford a cycle of responding to predictable shock without addressing underlying risk.
Across Nigeria, humanitarian needs are rising. Families are facing increased food insecurities. Children are facing alarming level of malnutrition. Civilians in Borno, Adamawa, and Yobe continue to live in the fear of increased violence attack.
Children are among the most affected. UNICEF says 3 million Nigerian children are acutely malnourished, describing the nutrition crisis as widespread across the country and stressing that life-saving support, including ready-to-use therapeutic food, must be sustained. State governments warn that the humanitarian challenges are exposing children to child labor and early marriage. With funding under pressure and humanitarian needs continuing to rise, stakeholders say sharper prioritization, improved coordination, and sustained support are critical to protect the most vulnerable, especially children, warning that this is not the time to scale back life-saving interventions. Muyo Thomas, TVC News, Abuja.